My name is Dianne Hasselman. I'm with the Network for Regional Healthcare Improvement, and welcome to our conversation this afternoon. Again, we'll get started in maybe just another minute or so and let folks join. Great. I see a lot of folks joining our conversation. We're about to kick it off in just another minute or two. I see that people are still joining. But if you are here for the conversation about regional collaboratives and sustainability, then you're in the right place. My name is Dianne Hasselman. I'm with the Network for Regional Healthcare Improvement. And again, we'll get started in just another minute or so. Thanks so much. Okay, wonderful. I think we'll go ahead and get started with our conversation for this afternoon. I see folks are still joining, but it's already a little bit after 2 o'clock here on the East Coast. So why don't we go ahead and get started? Again, my name is Dianne Hasselman. I'm with the Network for Regional Healthcare Improvement, and I'd like to welcome you to this conversation this afternoon. We have assembled what I think is a fantastic group of folks from not only the research and academia, but also from the field, working within regional collaboratives to improve quality and try to advance delivery system and payment reform on the ground, in the field, day after day. And challenging issues are arising around sustainability. We've heard from many of you over the last many months that sustainability is one of the issues that keeps you up at night, and that is really a struggle. So we've designed this conversation this afternoon specifically to delve into that and from the regional collaborative perspective. I'd like to welcome also the Choosing Wisely grantees. They are an important part of the landscape in terms of quality improvement and working within their communities. And so they'll be joining the conversation this afternoon as well, and listening in and submitting questions for the folks on the that are joining me. I'll introduce my colleagues in just a second. But we've designed this conversation this afternoon to hear from leading researchers in the field who are looking at sustainability of regional collaboratives, and they'll kind of provide that landscape. I'm thrilled to have Larry Harold, from the University of Alabama in Birmingham. He's with the Department of Health Services and Administration, and his colleague from the University of Michigan, Jeffrey Alexander, with the Health Management and Policy Division there, the University of Michigan. They'll be sharing what they are learning in research, both what type of research has been done in the field so far around sustainability for regional collaboratives, and also share some key themes that they are teasing out from some of the upcoming research they're doing for the Aligning Forces for Quality initiative that was so important and was supported by the Robert Wood Johnson Foundation. So I'm going to turn it to Larry in just a second. Once I do that, he's going to speak a little bit about his work, and Jeffrey as well. And from Penn State University, Jocelyn Vanderbrink may also chime in from her perspective. She's very familiar with the AF4Q initiatives. Then we'll turn to some folks from the Washington Health Alliance. We'll hear from Nancy Junto, who leads that leading edge healthcare collaborative, who has been involved in Choosing Wisely and Aligning Forces for Quality and many, many other initiatives. We'll also then turn to Health Insight Utah, and we'll hear from Ali Miraglia. I hope I pronounced that right. And she'll be sharing some of her insights from their work in choosing wisely and thinking about sustainability and how they've done that. Linda Schwimmer, who leads the New Jersey Healthcare Quality Institute, will chime in. She was not in AF4Q and not in Choosing Wisely, but is doing some incredibly innovative thinking around sustainability and positioning her organization so it's really vibrant and viable. And then lastly, we'll turn to Connecticut. We'll hear from Nancy Yedlin. She leads as part of the Leadership Council and the Connecticut Choosing Wisely Collaborative, and is also with the Donahue Foundation. So we're thrilled to have everyone. After we've heard from the researchers and also from the field, we can certainly open it up for any questions that you all might have. And if you look at the bottom of your screen there, you should see a little box that has Q&A. And if you go in there and submit your question, I'll be able to read them and then direct them to whoever is most appropriate or who wants to chime in from our panel today. So without further ado, thank you all for joining. Larry, can I kick it off to you and hear a little bit about what you've learned so far and where you're headed?
Absolutely. Thank you, Diane, and thank you to everyone else who's joined us here today. So with my time today, I'm going to set the stage by providing some context for some of the things we'll be discussing today and briefly describe some of the things, some findings from a literature review that we completed related to sustaining organizations such as regional healthcare improvement collaboratives. So as many of you know, the Robert Wood Johnson Foundation has invested a lot of money over a long period of time in the Aligning Forces for Quality program. And given this investment, they are very interested in understanding what sort of legacy their funding may have and consequently where alliances are headed moving forward. Therefore, as part of the overall evaluation that our team has been engaged in, we were interested in looking at issues related to sustainability. And to provide a foundation for some of that work, we began with a review of the research literature. And the purpose of that review was to address simply one overarching question. What do we know about sustainability in the context of collaborative organizations such as regional healthcare improvement collaboratives? Now, it's probably worth noting here that in my remarks, I'm going to be referring to these collaborative organizations generically as alliances. Others may refer to them as collaboratives or coalitions or partnerships. Be aware I'll be sometimes referring to them as alliances. So this review I mentioned was completed in early 2015, and it's probably impossible to discuss all the review's findings in the time we have here today, and which is probably fortunate for all of you. I'd like to highlight a few conclusions for you. I think first and perhaps the most important takeaway from our review is that the existing research literature offers relatively few definitive conclusions about sustainability in terms of what it is, what it looks like, and what can be done to improve the chances of sustaining some activity. Therefore, it's somewhat difficult to make generalizations about what alliances should be doing to promote sustainability, at least with any real confidence. Now, there are several reasons for this based on our review. First and foremost, relatively little research has been done in the area of sustainability in this context over the past 24 or 25 years. That was the span of time our review included. There were 42 articles, to be exact, that our review discovered. And that finding in itself was not necessarily surprising to us, given that the funding mechanisms that are used are often time-limited and don't necessarily support studying programs over a sufficient period of time to examine issues of sustainability. However, another reason it was difficult to draw definitive conclusions from this research is that definitions of sustainability tended to be either lacking or they tended to vary widely across the studies that we found. So more specifically, the studies differed in what they focused on being sustained. In some cases, it was the organization itself. In other cases, it might be a specific program or intervention that the organization was involved with. And those types of differences presented a number of challenges to making generalizations about sustainability based on this review. Despite those challenges, in the review, we developed 4 groups of factors or things that these studies have looked at and found to be associated with sustainability. The first set of factors pertain to having a shared vision and plan. The second set of factors related to infrastructure development, which focused on or captured factors indicative of the development of internal support systems. So this might include things such as having an information technology system to support communication, or having a diverse set of financial resources and a business plan to maintain those financial resources. The third set of factors was related to systems-oriented change, or factors associated with developing and implementing programs that account for the multifaceted and interrelated forces that underlie many community health problems. So examples of things in this category might include having participation from a broad group of stakeholders in the community, or having a diverse board of directors as a part of the alliance. And the fourth and final set of factors associated with sustainability that we identified in the review pertain to monitoring and evaluation. And things in this category included things such as having goal-aligned performance measures, or the ability to document and communicate program results to stakeholders and funding agencies. So as I mentioned before, these findings provided what we thought was a reasonably solid starting point for thinking more systematically about how to study sustainability in the context of the Aligning Forces for Quality Alliances. So for example, the range of ways other studies define sustainability led us to inquire about participants' prioritization of the different things that could be sustained, such as the organization itself, the programs that were offered by the alliance, or perhaps the neutral forum that has been cultivated by an alliance over time. So at this point, I'd like to provide kind of a brief overview of the approach we use to examine sustainability in the context of the 16 alliances that were participating in the Aligning Forces for Quality program, after which Jeff will describe some of our preliminary findings. So our approach in looking at sustainability generally has 3 components. First, we developed a strategic classification system to characterize, in very broad terms, what the strategic directions of the 16 Aligning Forces for Quality Alliances were as the AF4Q program ended. Second, we developed and administered a survey to assess the opinions of key stakeholders in the alliances that asked about what they thought the strategic priorities of the alliance should be moving forward, how well they thought the alliances were positioned to move forward on those priorities, and what sort of challenges they anticipated the alliances would meet as they move forward. This survey was directed towards all key stakeholders, including staff members, board members of the alliances, committee members, advisory group members, and members at large from the community. And the third component, which we are currently working on, is trying to weave together kind of a plausible story about the Aligning Forces for Quality Alliances and their future, given all the information that we have available, surveys, the strategic classification, and other data that we've been collecting as a part of this evaluation. Given that the evaluation is in the summative stages, this is a work in progress, very much so. So with that, I'll turn it over to Jeff, who is going to describe some of the preliminary findings from that work. Jeff?
Great. Thank you, Larry, and thank you, everyone, for joining today. I'm going to do a very broad brush picture of what we're finding to date. There's probably a lot more detail to come, but this will, I hope, give you a sense of what we're seeing so far and what we hope to be pursuing in the near future. Larry had mentioned that the first part of our effort was to really create a typology of the strategic direction in which these 16 alliances under A4Q were headed. And by strategic direction, I'm really referring to the alliance's stated goals and the major courses of action that they've chosen to pursue those goals. What we ended up having is basically three categories. The first being alliances that were essentially pursuing the same strategic direction that they were following under A4Q. So no major changes, no major shifts going forward after A4Q. The second category consisted of those alliances that were experiencing a change in strategic direction. They may have retained some of the A4Q activities or programs, but there was clearly one or more additional goals that they were pursuing that they had not been pursuing under A4Q. And then the third category was a group of alliances where there simply was no strategic direction observable. So those are the three categories we were working with, and here's what we found. And this is not entirely good news. The largest group, nearly half, 7 of these alliances fell into the no clear strategic direction category. These alliances consisted of 2 that had formally disbanded entirely, several that were engaged in a strategic planning process, but where a clear strategy had not yet emerged, and yet sort of another group where there just was no clear evidence that there was any direction going forward. The second largest group consisted of those alliances that were chartering a new course. And there were basically 3 subcategories in this general group. One subcategory were those alliances that we termed expansion alliances. These are alliances that adopted one or more major strategic goals and related courses of action while continuing all or most of their previous goals and related courses of action. So this is why we call them expansion. And there were 3 alliances that fell into this category. The second category, subcategory in this group, were alliances that we termed retrenchment. And these were alliances that, again, relative to A4Q, had eliminated one or more major goals and or related areas of activity and really specialized in areas that they viewed to be their core competencies. So they were really much more focused, much more narrowly focused than they were under A4Q. And then there's a smaller third subcategory that we call reinvention. And this consisted of one alliance where they really had sort of moved beyond A4Q entirely and were really charting a course of action that was entirely new and an entirely new strategic direction. Again, one category. So again, this will give you at least a general sense of where these alliances appear to be headed, or in some cases don't appear to be headed at the conclusion of the A4Q program. Larry had mentioned that the second major activity consisted of a survey that was monitored or given to A4Q Alliance members, and there was over 700 responses to this survey that were spread across 15 alliances. We did not include the 16th because they had disbanded before the survey was administered. What I'm going to do is very briefly touch on some of the high-level findings, and we can discuss those in more detail if you like at some later point. The first finding that we sort of came with is that a lot of the strategic priorities mentioned by the alliance participants seem to emphasize the need for more focus and at the same time more flexibility. A lot of alliances are seen to be doing too much and sort of a grab bag of activities that don't appear to be related to each other. So the need for more focus and more focus on core strengths seem to be a theme. At the same time, there was a clear recognition that the healthcare environment is dynamic and things may not be stable over the long term, and that suggested a need to be monitoring, but also the need to be responsive and the ability to shift on fairly short notice. The second major theme had to do with the fact that alliance members seem to suggest that the future goals of their alliance seem to be clearly laid out, and there seemed to be general agreement about what those goals should be. However, the means to get those goals or to achieve those goals was not that clear. And to be specific, the survey respondents tended to be less positive about the strategies that were in place to achieve those goals and whether the alliance had both the right community partners or sufficient financial resources to realize those goals. So this is a good news, bad news story. Clear goals, but real questions about the means to achieve those goals. Third finding, third takeaway, financial support and the right community leadership tend to be significant missing pieces in the sustainability puzzle, at least from the perspective of the survey respondents. The finances, not surprising. Everyone needs more resources. That's kind of a whole finding. The community leadership finding was a little bit more surprising to us because AF4Q, as many of you know, really did emphasize multi-sectoral involvement and involvement of different sectors ranging from payers to providers to consumers, et cetera, et cetera. But there was a clear message that the right community leadership was not necessarily in place to achieve the alliance's future goals post AF4Q. And then maybe to sort of wind up with a good news theme or good news finding, despite all the issues that the respondents raised about sustainability and how the alliances were currently positioned to sustain themselves over the long term, they were generally pretty optimistic about meeting the sustainability challenges going forward, and really dramatically so. So although there were some concerns expressed about current positioning, there was also a significant amount of optimism expressed about the ability of the alliance and its stakeholders and members to meet those challenges going forward. So those are the basic takeaways so far. What remains to be done is, as Larry suggested, to really come away with a conclusion about where these AF4Q alliances stand with respect to sustainability, and then finally to really formulate a set of lessons learned and recommendations for not only the current AF4Q alliances, but also for communities that are thinking about engaging in similar activities. So I'm going to stop here, and I know the main show is with the folks that are actually doing work on the ground, and I'm going to be fascinated to hear what they have to say.
Oh, great. Well, Jeff and Larry, thank you so much for that overview and that insight, and we really look forward to the formal results coming out from all of your research. And some of these key themes, I mean, I'm nodding, they're just making a lot of sense, particularly the last one on the dramatically optimistic. The leaders from, at least in NRHI's network that are doing the work in regional collaboratives are dramatically optimistic, and they are, I just think, a fantastic group of leaders. And we're going to turn to one of them right now. So Nancy Junto in Washington State. Nancy, you were an AF4Q Alliance. You've done Choosing Wisely. You're a major part of the SIM initiative. You have a strong membership base. I mean, you really encapsulate so many different strategies around sustainability. Can you just give me a little bit of a kind of a snapshot of sustainability? What's been working? What still keeps you up at night? Just give us a sense of where you all are.
Thanks, Diane, and nice to be a part of this and welcome all the participants on the phone. So at a broad level, the Washington Health Alliance is funded 70% from a dues structure. So we are an alliance that brings together all the stakeholders, and we are supported by their annual dues. The remainder comes from federal and other grants. A thought that really resonated for me from listening to Larry and Jeff and their research, you know, I think the board of directors is a really big part of this, and I personally spend a lot of time with board members, both recruiting, retaining them, and maybe Dianne, I could just say a few words about the importance of the board, maybe to kick off some thinking about that, or would you prefer to wait?
No, absolutely. This is your time to help the rest of the field figure it out.
Okay, well, I'm not sure we've figured it out, so we have a lot to learn here as well. But I would say that our board is represented by 20 significant healthcare leaders from across the state. So these are the most senior leaders of health plans, some of the providers, state leadership, union trust leadership, and purchasers. So we are lucky about that. I mean, I would say that board members of that caliber frankly want to rub shoulders with others of that caliber, so you have to get a nexus of board members and grow from it, which is the challenge to get started. I was lucky and inherited some of that. I would say with busy people that you ask to engage in the board, I found it effective to actually give them assignments and work to do. I mean, they want to feel that they're a part and want to be spending their time wisely. And so I ask frequently. They can reserve the right to say no. I don't hear that often, gratefully, but I encourage them to really get very involved. And I would also say that something we found that's been effective is we remind these folks at the start of every board meeting, the board chair does. He calls for any conflicts of interest at the start of the meeting, reminding everyone to not put on their organization's hat, but the alliance's hat. So people declare, is there anything on the agenda they can't execute their leadership and fiduciary duty around. And it seems to really help because it allows them then to call one another on it if it appears that someone is entrenching a little bit into their organization's point of view. So maybe I would just start with the importance of the board and let you address others, Dianne.
That is fantastic and really interesting insight. So Allie, I want to turn to Utah. You all had a Choosing Wisely grant, and how have you kind of kept that work going, or other projects? When the grant funding ends, what do you do? And just give us a snapshot of how you do it in Utah, and some of your impressions and thoughts.
Sure. Thank you for having me. I just want to say what a technological feat this is. Very impressive. Wonderful. So yeah, and you pronounced it correctly, Allie Maraglia.
Oh, good.
So I work in community engagement initiatives around health insight, and a little bit of background with our relationship with Choosing Wisely began around December 2013 with a big community awareness campaign. And when that project ended, we tried to focus on maintaining momentum with the partners we had created from that grant, which namely were Head Start. And we worked with them to kind of embed into their educational curriculum some Choosing Wisely information to educate early childhood providers on antibiotic and radiology overuse, which is a big issue in Utah. And now our newest project is called Cambia Navigators. It's funded by the Cambia Health Foundation, and it aims to understand how newly enrolled Hispanic consumers in low-income areas of Salt Lake City are using their health insurance, and then to develop tools to help them navigate the healthcare system more efficiently and effectively. And we're partnering with Head Start and other organizations in the community that have a little bit of background knowledge on Choosing Wisely, but some of the pillars of the tools that we are creating incorporate patient-centered resources that were developed by Consumer Reports Partnership with Choosing Wisely and some of their materials that I'll talk about in a second. But really we found that a kind of a combination of 3 tactics work really well when trying to sustain choosing wisely type initiatives. The first one is to partner like crazy. So either through funded activities like our new Cambia Navigators project, where we use the collective impact model to kind of create shared responsibility to push messaging, or through unfunded activities. We have a Utah Partnership for Value working group that's kind of a community collaborative that meets quarterly, and under that overarching structure we have sub-work groups that focus on specific topics, one of which is choosing wisely. So we have an entire work group dedicated to that meets more frequently. The second tactic is to embed your message with others. So we've incorporated choosing wisely messages into this new project. This is a magnet that we've created. I don't know if people over the phone can see this, but at the bottom there are 5 questions to ask your doctor during or before any test, treatment, or procedure, which are some of the more patient-centered choosing wisely aspects that Consumer Reports created. And then in a Utah Health Resource Guide that we have for this new project, we have some community resources to navigate the healthcare system, as well as articles on facilitating positive doctor-patient relationships. So just trying to incorporate and integrate that material moving forward into other projects wherever we can. And then the last tactic is we try to never let the message go out and always be looking to scale the work forward. So this seems very easy, but in practice it takes a lot of creativity to find ways to incorporate choosing wisely where it may not initially seem like a natural fit. But my experience with all of these community engagement type projects is that choosing wisely materials generate a very positive community response, indicating that it's definitely something we're going to continue to align ourselves with and continue to look for funding opportunities and partnership opportunities to keep that momentum going.
So, Allie, just so I want to make sure I get that last point. So, sure. You're just saying that the choosing wisely message and mission and vision and materials, that for you all is something that you consistently bring into whatever conversation. You find a way to incorporate it, to connect the dots. Is that what you're saying? So it's really embedded. Okay, that makes a lot of sense.
It's all about embedding it moving forward.
That's fantastic. So we got a lot of different strategies and ideas from you, and I love the one of going to education, like working within the outside of the healthcare system. What a concept! Mm-hmm. Partnering like crazy, embedding the message with others, and then just having your having the message be consistent and be a part of all of the work you're doing. So that's fantastic. Thanks so much for that. So Linda Schwimmer, New Jersey. How are you guys sustaining your organization, and what are the opportunities? And give us a sense of what you're doing out there. Oh, you might be muted. Are you muted there?
Yeah,
there we go.
Thank you. Thank you, Diane, and thank you, everybody. I really appreciate the opportunity to be on the call today. We are a pretty unique organization. We've been around for about 17 years, and like all the other NRHI members, we're made up of all the different stakeholders in the healthcare system. I really appreciated the earlier comments about the board structure, and I wanted to share a little bit about our board because it's slightly different. Our board members tend to be a lot of former health commissioners, banking and insurance commissioners, leaders at the former governors, et cetera. So many of them are no longer actively involved. They're sort of a board of experts that we rely upon, and we can, and they have the benefit, many of them, of being retired, of basically being somewhat neutral. And then what we have instead is what we call a leadership council, which is they're in our membership, and they're higher paying members, which goes to the sustainability. About 60% of our revenue actually comes from membership. And so they come to the table, and there's one leadership council member from each of the sectors of healthcare. It's an exclusive group. But they don't decide our policy. Our policy is set by our board, which does have the advantage of being a little bit more neutral. But our board and our leadership council meet together regularly with staff to discuss policy policy issues. And one of the values for those Leadership Council members, as well as all of our members, is that they really do like that seat at the table. The Quality Institute, I think we were recently described as the entity that calls balls and strikes in terms of, everything happening out there in the healthcare system with so much changing and so many things going on. It's nice to be viewed as that trusted entity that really does represent all the stakeholders in healthcare. So the membership is a key part of it. Another 30+% of our funding comes from different grant opportunities, and another 10% comes from income that we get. We run a education program jointly with Rutgers University on healthcare policy. Some key lessons I would say to help me struggle with staying up at night in looking, and particularly for opportunities for where we're taking our programs, as well as what type of grant funding that we are considering, is that I really do try to look at it through the lens of what our mission is and what our strengths are, because there's so many different opportunities coming down the pike, and we, I think, like many regional health improvement collaboratives, are on the small side. I won't even tell you how many there are of us, because I feel like it's a little bit like the Wizard of Oz. You don't want to pull back that curtain. But we are small. We're a staff of 7. We also have a lot of outside experts and consultants and things that we work with. But it is important not to try to take on too much or to let mission creep get in there. So what we try to do is take on projects that play to our strengths, that are of great value to our members, because then that keeps the membership up, and to really do things where we can differentiate ourselves. There's a lot of different entities out there. Many of them have great skill sets, and I don't need to be trying to directly compete with them if there's organizations in our region that are already doing great work. Instead, we try to partner with them and complement the work that they're doing and bring to it what our strengths are. So one of the, I think, unique initiatives that the Quality Institute has is something called the Mayor's Wellness Campaign. We work very closely with a group called the League of Municipalities, which represents all 565 mayors in the state of New Jersey. And we have over 380 of those mayors committed to our Mayor's Wellness Campaign, which is really a campaign that looks at the mayors as leaders and champions for change. And so we take a lot of the healthcare policy work that we're doing, and a lot of the we do a lot of work around payment reform. So we take a lot of those more wonky, detailed programs and bring it to the grassroots and help mayors really make their communities better, healthier places for their citizens. We give them very simple toolkits. We have rewards and mini grants, and we help publicize them and get them the PR that as politicians they want for credit for improving the quality in the healthcare in their communities. But then working with mayors at the local level, of course, is very attractive to many of our members. I mean, mayors and what's happening in the community is very important to hospital systems, to health plans, et cetera. So it really is a way to create a lot of synergies, which then obviously helps us with our sustainability. So I'll stop there because I'm sure I raised some issues. Hopefully we can have a discussion around. Absolutely.
And I have to say, Linda, I've been so impressed by all of the educational programs and the emails and newsletters, your blogs, like everything I get from your organization. It's very clear that you are you commit a lot of time and thinking to kind of taking care of your members and taking care of that network. So and keeping them happy and keeping them well informed. So it's incredibly impressive what you're doing. So thanks so much for sharing that. And then the last voice from the field we want to hear, we're going to turn to Connecticut and Nancy. can you talk a little bit about just a snapshot of what is going on in Connecticut? And be sure to unmute. There you go. Perfect.
Yes. Okay. Thanks, Diane. I'm happy to do that. So thanks for inviting me to participate. And I'm going to spend just a minute about the structure of our collaborative because it does show our point of view in coming into this conversation. So in 2014, a number of organizations, and now there are 11 of us, decided to form a collaborative expressly to promote awareness and implementation of Choosing Wisely in Connecticut. So we started from scratch in a very focused manner, and that was a very conscious decision. We were not a Choosing Wisely grantee. We were not an AF4Q grantee, but we all really wanted to work on this together, and we didn't see another spot. We didn't have a Health Insight. We didn't have a main quality accounts organization that we felt would be a good home. So we decided to start it ourselves. All 11 members contribute dues. That's how we do it, or in-kind contributions. For example, one of our members acts as the physical agent for the collaborative. Another member has recently given us a grant to work on Choosing Wisely and how it can help underserved populations, and that's how we know Allie. We've spent a lot of time on the phone with her and her group. So we don't really have staff. We've purchased some small amount of program resources, and we've expressly said our goal is to be a catalyst to embed Choosing Wisely in the sectors where it needs to happen: health systems, schools of who are educating health professionals, consumers, and payers and employers. And we have all of them at the table. You can go to our website, choosingwiselyct.org, to see who is at the table with us. But what we're finding now is, as we're beginning to get word out and to gain traction and really create demand for Choosing Wisely, we're starting to realize that our model may really need to change in order for us to keep up the pace and continue to build momentum. So, we have a mostly all volunteer force, and it's limiting us now. So we're really starting very seriously to grapple with the issues that all of you are talking about, and we're asking ourselves questions. We don't have the answers yet. So should we expand beyond Choosing Wisely and sort of work on more of like high value in healthcare? Obviously, there's a lot of interest in that. Should we do that? Should we see if we now can identify a more resourced organization where we could sort of find a home for Choosing Wisely? And would that be good, or would that divert attention from our shared goal? We're also wondering, we in theory, we have a structure to invite more members, but we have not operationalized that. What sort of dues would we pay? Would we ask people to join us and pay? And then that would require us to really think about what value-added services like some of the others. And again, at this point, our leadership council is high-level folks from organizations, which is a very positive thing because they're all working in this field in some way. It aligns with their mission. However, can we really provide the services that people would want to purchase and that we feel would be valuable? And two other things, we're trying to, one of the things is, should we make a priority seeking additional grant funding to support our activities? And as everyone knows, it takes resources to identify those opportunities and then to pursue them successfully. So we're grappling with that. And something I've said to Dianne is, why isn't there more funding for backbone, to create backbone and infrastructure? It's very frustrating. It's tough to see where the business model is given the priorities and missions of most funders. And then just finally, I'll say another thing on our table is, should we consider a future date to sunset the collaborative? If our goal is to catalyze uptake that we can measure, and we're starting to work on that, maybe we'll be able to, declare victory and go home at some point. We're not ready to do that because we have a lot of ideas, and we're really trying to figure out how to make them work. I'll just say in closing that we've had a really wonderful experience with working with ABIM, working with Consumer Reports, working with all of the grantees and other Choosing Wisely and partners who have really helped us think about these issues. So we have no answers yet, but I'm happy and appreciate the opportunity to share.
That's great, and thanks so much for being so so candid and open about some of your challenges and struggles and the questions. And I assure you, you are not alone in this. So this is great. So let me. So we're going to turn to asking questions and follow-up questions of the folks here today. Again, if you have a question, submit it in the Q&A. I've been told, I think it's at the top of your screen. It may not be at the bottom, so feel free to submit. But I would also encourage Larry and Jeff, if you have any questions for the regional collaboratives, to jump in. But I just want to kick it off and to ask, throw it out to whoever wants to answer it. There has been such an abundance of federal dollars that have been coming forth from CMMI over the last few years. I don't know if those are going to continue, but I'm wondering, has that been a critical strategic part of your sustainability for your either organization or some of your initiatives? Is the juice worth the squeeze? Just some thoughts on some of the federal opportunities, because there are more out there, as you know.
So Dianne, I'll start out and take that to the Washington Health Alliance. Those dollars are very important. We're lucky that we work with a state that's quite progressive, a healthcare authority that's quite progressive, that's been the beneficiary of SIM funds. It's a big part of our funding this year for both value-based purchasing and also development of common measure sets. So for us, it is a very important part, and it's worth the squeeze, as you say, because we have a great partnership with the healthcare authority that connects very well with others across the state and makes it easy to put the fund dollars to good work.
That's great. Linda, did you have anything to say? It looked like you were trying to say something there.
Yeah, sorry, and I had a technical difficulty, so I missed Nancy's last point, so I hope I'm not repetitive. All I wanted to say was that, these are so competitive, and sometimes they're not a great fit as a whole, but what we've had success with is partnering with other entities and becoming a subcontractor or partner with them. For instance, on the PTN, we're going to be a partner. We're a subcontractor on the SIM. The accountable care, the accountable communities, being a bridge organization wasn't a good fit for us, but we gave our members value by having a short webinar and then connecting all of them, and many of them are applying together, and we've been able to be that literal bridge, even though being the bridge organization under that grant doesn't make sense.
That's a great strategy. We have a question from the P2 Collaborative in Western New York. So any advice on how a grant-funded organization can start the process to developing a more sustainable model, essentially building from scratch? So Nancy, this is similar to, I think, one of your questions. So any advice on how do you do that? Do you start with membership or sponsorship or meetings, or how do you get that going?
I would like to say something about that. I think some of the other people have mentioned the key of having a strategic direction, a neutral forum, trusted, where people get together and really trying to work on something together. And I think part of figuring out the answer to John's question is really going out and really talking to various leaders in organizations in the community to really figure out, like, who has a passion, how does this tie to their goals. We're seeing more health systems interested in Choosing Wisely, for example, because of the pressure on them to create value-based payments. So I think it really is going out and really trying to figure out what the goals are and the imperatives of others in your community to bring them with you and see if then they're willing to support it.
Insights from others.
Well, I think a comment was made about, adding value, which is really important. So I think having an idea, I agree with Nancy's comment about going out and talking to people. That's where relationships start and you understand. But once you have that, really thinking about, so for that particular stakeholder, how are you going to add value? And how can you create a common vision? And it's really hard work to both build and sustain.
What about, so some of you have regional funders or regional philanthropies in your states or areas. Has that been part of your strategy or part of your thinking, or no?
So again, I'll chime in here. We don't pursue regional philanthropy. I think it's an interesting thing to think about. Many of our partners are like, the American Cancer Society, Heart Association, etc., and they come to us as members. I suppose if there were opportunities in our sweet spot, we would pursue it, but it's a little hard to go to your members and then ask for philanthropic dollars on top of the membership commitment they've made. So we haven't pursued that in the state of Washington.
We do work with regional funders. Many of our pharmaceutical companies have foundations here in New Jersey. We also are very lucky to have the support of the Nicholson Foundation, which is focused on the Medicaid beneficiaries, the underserved population. And I think what makes us attractive to them is, again, that sort of neutral entity. We don't represent just hospitals or just physicians or just federally qualified health centers. We really can bring all of these different groups together, which that level of neutrality as well as multi-stakeholder focus is very attractive to different groups, and it really does differentiate us. It also is freeing, and it allows us to really get back to the patient and to the healthcare system and what's going to make a difference, particularly when you're talking about Medicaid, where it's literally fighting for proverbial scraps. We can sort of start talking about it. How do you just upend it and change it and make it better for the patients? And I think funders like to see that, because they as funders, they really want to try to make a difference in the system that's long lasting, especially a lot of these spend down foundations. They're trying to look at what their legacy is. So if you as a regional improvement collaborative can show a vision for that, I think, that is really what makes us attractive to them.
I would just agree with what has been said already, that partnering is so important, and we as well consider ourselves a neutral convener and see a lot of power in the ability to bring different types of stakeholders together under that name. And we don't necessarily look for specific types of funding, but a lot of funding that is aligned with our mission, as was said before. And a lot of the work we've been doing recently is in partnership with other community health organizations in the Utah or Salt Lake City area. And when we apply for grants under the collective impact model, there seems to be a lot of power in that and inherent sustainability when you get buy-in from all these partnering organizations.
Great points. Other questions, maybe questions you might have of each other, and curious about what's happening in other states or other strategies that you've taken. I have more questions, but I don't want to hog the spotlight here.
I was intrigued by Linna's comments about the New Jersey model. I think that's really interesting. So on our board, we have a couple of former policy leaders. We combine them, but I think it's an interesting approach. And it may be for organizations that are thinking where to start. It might be an interesting thing to think about. Folks who are no longer in elected office but have all that knowledge and have all that community pull. Really interesting thought.
I think one of the things too, thinking about it strategically, we were concerned if we had a board member, say that was from our Blue Cross plan, that would make somebody from United or Aetna or another national player less likely to want to be engaged with us, because they would feel like one group, a competitor was steering the conversation. That's why we try to have people that are not specifically affiliated with a particular company on the board, but then we still want to have all of those plans in our membership as well. And the same thing would go with the hospital systems and all the other stakeholders. I can't say we always avoid controversy, though. It's a balance.
So Dianne, a question I throw out for the group, you kind of ask some others what keeps you up at night. So what keeps me up at night is figuring out how to get non-governmental purchasers more engaged. So, we have a lot of strength with some of our purchasers, some names you would know well that are based here in the Washington area in the state. But sort of getting their attention around value-based purchasing is a challenge. I've wondered in part if it's because our state does relatively well economically, and business pressures are much more focused on retaining employees, attracting and retaining employees, and not so much on fooling with benefit design. So I'd love it if any of the folks on the phone have ideas about how to engage non-governmental purchasers to a greater extent, or anyone who's in the audience. I'd love the perspective.
Any thoughts on that? This is definitely a tricky one. Well, I think you've identified.
Maybe it's something we could all work on together.
Absolutely. I think that's the kind of the sleeping giant, I think, is the employers, and getting them to understand and getting them activated and getting them to help sustain some of these efforts and opportunities.
Nancy, I think, some of our struggles with that is a lot of, at least here, a lot of the largest employers other than the state are hospitals, which, wear two hats in the delivery system. So they're already engaged, but for two reasons, as an employer, as a provider. But we're also the regional rollout entity for Leapfrog, and so talking to employers about quality always is a start, an important start for us. We also have a lot of labor unions, a lot of Taft-Hartley plans, and they are very, very concerned about health benefits, because they're, literally when they say they're members, they are their members. It's coming right out of the paychecks, and they're trying to show value to their members and making sure that the benefits that they're getting are quality, end up to be quality care. And then the public unions are very concerned, because they don't want to see sort of a knee-jerk shift to high deductible plans, particularly when these are benefits that are been negotiated at the expense of flat wages. So we see a lot of interest from those groups in the conversations, and they want to be educated and informed, and that's why we do put out these newsletters and blogs and things like that. They really want to know what the options are and what's coming down the pike. We might not have all the answers, but they want to be at the table so that they can feel engaged and to influence whatever's going to happen. And that's been useful in terms of just, keeping them, at the table in membership, and then working on projects together, like a Choosing Wisely project, or some other quality improvement project.
This is Nancy. I'd like to add something here. So in our leadership council, we have the Connecticut Business Group on Health as a member, which has been wonderful. And actually, what we've been able to do is really excite one of their board members who has a company in Connecticut with about 1,500 employees to do be one of the employer pilot sites for Choosing Wisely. So they've gotten very engaged, and we've gotten them to start presenting at different venues the work that they're doing in piloting the employer toolkit and use of Choosing Wisely within their workforce. The other thing that's helped us also is that we do have the State Comptroller's Office in Connecticut as part of our collaborative, and they're responsible for 200,000 active lives and 100,000 retiree, and they're very involved in value-based purchasing nationally and in Connecticut. So they're part of our Choosing Wisely collaborative, very excited about it, and so it works that we're benefiting each other. They are a great spokesperson for this in their community with unions and management. So we're trying to leverage all of that to sort of fan the fire for the kinds of groups that you're talking about to get engaged.
That's great. Well, we are already at the top of the hour, and I just wanted to, first of all, thank all of you for participating and sharing your experience from academia and from looking at and researching the Aligning Forces for Quality program and from your work in Choosing Wisely and just being a regional collaborative day in and day out. I mean, it's not for the faint of heart. So thank you so much for sharing your ideas, your challenges, the opportunities, and for everyone who joined us today and to watch this conversation. Thanks so much for your time, and we'll see you next time. Thanks again, everyone. Take care.